There we go.
I personally like the month of Mary. All right, folks, it's 1 o'clock, and it looks like the attendees have started to slow down a little bit. So I wanted to go ahead and get started with today's presentation. This is Brian Dowd. I'm the Deputy Executive Director over Policy and Compliance at the Department of Community Health. And today we're going to be doing our first in the 2021 webinars on EVV. So Joe, if you could advance me, there you go, perfect. So the mission of the Georgia Department of Community Health is how we start all presentations, and that's to provide Georgians with access to affordable quality health care through effective planning, purchase, and oversight. Today, we're going to be going over the administrative portal. You guys won't have to hear much from me, which is a good thing. I'm going to touch very briefly on communication resources, and then at the end, we'll do a Q&A. I would ask that the Q&A be specific as much as possible to the administrative portal information today. Next slide, please. Okay, so real quickly, I want to go over all the communication streams where we're trying to get information out to you. So if you haven't been to our website, the top one is our EVV specific website. There are breakouts for providers and families there and members. So all of that is available to you. All of our PowerPoints are online, including recordings from every single meetings. We have flyers and announcements. We have member surveys. We have a very comprehensive frequently asked question for providers. Very comprehensive if you go on, and quick reference guides. I get a tremendous amount of really good questions to the EVV mailbox, and that's at evv.medicaid@dch.ga.gov, this second bullet. So I would encourage you, if you don't think of your question today, if it's not about the administrative portal, to please submit your question to the EVV mailbox, and I or one of the team members here will specifically respond to your question. Thanks. So now I'm going to turn it over to Joe Schnurr, who is the Chief Customer Officer with TELUS, to go over the EVV administrative portal. Take it away, Joe.
Awesome. Thank you, Brian. And hello, everybody. Happy Friday afternoon. It's great to be with you. And I look forward to giving you a sneak peek to what we call our administrative portal. You could call it a provider portal, but it's the web-based portal that providers are going to use for multiple administrative type functions. So again, this is not training. There will be plenty of training later as we get closer to go live. So you don't need to take notes, or if you miss something, not a problem. You're going to hear about this many, many more times. Think of today as just a sneak peek so you can get an idea of how it's going to work at a high level. Okay, so last time, in our last call, we had a town hall, I believe the second week or so of December. We went through the mobile application. And if you missed that, I encourage you to go to the DCH website and download that session, and you can hear all about the mobile application. And that's primarily used by the caregivers to complete their visits. And again, today, we're going to launch into the second component of the solution, which is the administrative portal, which you can see pictured on the right hand of this page. And this is used by the agency administrators, the fiscal agents will be using this, schedulers, and billers. Now, I will just say that if you are using a what we refer to as a third-party EVV system, meaning you already have an EVV system, and you're really only going to be integrating with TELUS for claims, then a lot of what we're going to go through today really does not apply to you, because this really applies to people that or agencies that are using the TELUS tool. Now, the next town hall will be going through how to process claims, and that will apply to everyone because you will use the portal to process claims, even if you are using a different system for EVV data collection. Okay, so we talked about creating visits, and last time we showed how you can create and complete the visit on the mobile app. Today, we're going to show you how you create visits and manage a schedule on the admin portal. Primarily, caregivers will complete visits on the mobile app. There are examples where maybe the mobile app doesn't work or my battery died, and there is an option to manually complete a visit on the admin portal, and I will show you how that works today. And then lastly is you bill, and the billing is done through the administrative portal. We will not review the billing features today, but we will review those in next month's town hall. Okay, so let me exit out of this and jump over to the dashboard. Okay, so I am logged into my dashboard. This is my TELUS EVV dashboard. Now, some of you may be thinking, oh, how do I get signed in? How do I get my username and password? How do I register? All of those things will be covered as we get closer to go live, because likely you'll forget all those anyhow. So we're going to have very specific sessions on how do you register, get your username and password, and actually get access to this dashboard. So you don't have to worry about that for now. We're going to cover that later on. So you can see up here in the toolbar up at the top, this kind of blue toolbar at the top, you can see I'm in the TELUS demo. I will just say this is a demo environment. And it doesn't have all the Georgia specific requirements because we are still building those out. So you may see some things in here and say, oh, that doesn't apply to Georgia, and you are correct. This is just a demo environment. As we get closer to go live, we will start to show you the environment with the Georgia specific service codes and the business rules and all the stuff we're working on now. As we get closer, we'll be able to start showing you. The dashboard will look exactly the same, except the data will be Georgia specific. Okay, so I just wanted to make sure you were aware of that. And you can see this is me, Joe Schnurr, and I'm logged in as an administrator in an agency. All right, so over on the left-hand side, we have a menu bar. Now, just so you know, you can shorten this menu bar by pressing this little toggle button up here to give your screen a little bit bigger. But I'll leave it open for now, just so because you're not familiar with all of these icons. So we're going to go through the dashboard, the schedule, visits, how I can go back and look at my visit history. We're going to skip over work list, claims, and authorizations because those are tied to claims, and we're going to cover those in next session. We're going to skip over reports today, but we will cover that in a future session as well. We'll go through users and recipients. And you notice training here also. Training, there is a link where you can go and get a whole bunch of training resources and user guides. And again, we're going to have a specific session down the road where all we do is walk you through all the training resources. So we'll go over that at a later time as well. We don't want to give you overload of too much information all at one time. That's why we're having these monthly calls, so we can give you a little bit of a time so you can wrap your arms around how all this is going to work. Okay, so we're on the dashboard right now, and you see these colored boxes. So each of these colored boxes represents a status of what's going on in your agency. So for example, you can see that we had 9 missed visits today. So these are visits that are scheduled, but they were missed. So say the visit was from 8 a.m. to 10 a.m. this morning, but the caregiver never showed up. And after 10 a.m., that visit will go from late to missed. Now, that doesn't mean that you can't start the visit at a later time. You actually can, but we just categorize them based on how they're scheduled. You can see there was one visit completed, and I'll click on this box, and then what it does is it flips me to the visit screen, and it shows me what that visit was. And so I completed a visit earlier today, and I wanted to do that just for demonstration purposes. So again, back to the dashboard. I'm back to the screen. And again, I can click in any one of these boxes and get the detailed information of what those, if I wanted to see what who missed 9 visits, I can click on that and see all the caregivers that missed their visits today. Okay, next thing you'll notice is this bar chart here. And this is really just a weekly representation of all your visits. Again, you can hover your mouse over these and it will tell you the number in each box. And again, you can click in any one of these boxes. When I do that, it takes me to the visits and it gives me all the detail. So back to the dashboard. There are some graphs down here at the bottom. These are all tied to claims, and we will cover those in the next month's session when we go over claims. So I will not review those today. One other thing to note is over on this right-hand side, you'll see this area, it's called your inbox. So in last month's session, we showed you how when a caregiver is in a visit, they can actually enter a note and they can send that note to their administrator. And when you do, that note will show up in your inbox. So you can see, for example, today, or actually yesterday, the 7th, at 3:13 p.m., one of my caregivers, Hannah Patterson, sent me a note, and you can see the note there. Now, if I click on this box, it will just expand it onto my screen. So if it was a long note, it would allow me to easily read it. So I just hit close, and it's back in there. It actually moved that message over to my read file. So you can see the difference between read and unread messages. That way, as you're reading them, it's taking them off your inbox and putting them over into the read inbox. So just think about this for those of you that use text messaging on your phone. This is very similar. Now, you can also message in the reverse order. If I want to send a message to Hannah Patterson in Hannah's TELUS mobile app, I can actually do that from this portal, which I will show you how to do that. So that's a quick overview of the dashboard. Think of this as your real-time view of what's going on with all of your caregivers in the field. So again, in a paper-based world, which some of you may still be operating in today, you really can't get any visibility. If you want to know what people are doing, you really have to call them. And if they're busy, you really can't get them on the phone. So this will give you a real idea of who is doing what through an electronic means. Okay, I'm going to skip down to users and recipients. So let's go to recipients first. So these are the members, the Medicaid members. You may refer to them as clients. These are your clients. And we are working on an integration right now between TELUS and the state of Georgia, where we are going to get a feed of all of those members, and they're going to come over and populate into our system. So when you go live, when you come to your recipient tab, all of your members are going to be preloaded. You're not going to have to load any of those. So that's a really nice benefit, that you don't have to come in here and load all your recipients into the system. Now, not all information comes over. So let's look at a specific recipient. And I am using Mr. Ryan for my demo today. So I'm going to type in Ryan. I'm going to hit search. It pulls up a couple Ryans. And I'm going to use Bruce Ryan down here at the bottom. So all the way over at the right, you see these 3 dots. So when I click on that, it gives me a menu. So one, I can deactivate that recipient if that recipient is I'm no longer a client of mine, or I can edit. So I'm going to click edit, and it's going to pull me into Bruce Ryan's profile. Now, again, some of these data elements may be locked down. They actually will be locked down. The ones that are coming over from the state, you will not be able to edit, because the state system is actually the source of truth. And we don't want other people changing that data, because then it won't align and we'll have issues with claims later on. However, there may be fields in the profile that do not come over. So for example, emergency contact information. So those types of fields you would be able to edit within the profile. You can see there's a bunch of other topics here in the profile up at the top. So let's go to addresses. So there will be one address that will come over in the feed. However, you may provide services to that recipient in multiple locations. And the system allows you to add additional addresses. And it's very easy to add additional address. You hit this little plus button, a little box comes up, you start typing an address in, and it starts giving you options. So I've added a few more addresses. I actually added a Georgia-specific one, and I made that my primary address, so that when I'm scheduling, this will be the first address that will come up on the system. Okay, so that's addresses. We can skip payer subscriptions for now. We'll go over more of that in training. This is all the notes. So any note made in any visit for Mr. Ryan will be saved under the notes. So you can go back and look at all the history, it tells you all the dates and who it was entered by. So that, and you can, search for notes as well. So very helpful there. Documents, you can upload documents. So for an example, I uploaded a DNR from Mr. Ryan. If you do upload documents, those documents will be available on the mobile application. So there could be an example where a caregiver in the home may need access to such a document, such as a DNR, or some other type of document that you may want to use. So they can use that, they can pull that up on the mobile application. And then if referring physician information is required, you can enter in referring physician information. Okay, so that gives you a pretty good overview of that recipients are going to be loaded for you, that there will be some fields that will be locked down, there will be other fields that you will be able to add information for. Let's go to users. So users are all users of the system. So that could be agency administrators, fiscal agents. You may have a case manager in your organization or somebody who's helping coordinate care. Of course, all the caregivers, everybody in your organization that's going to be using the system must be entered into the system in order to get a username and password. Okay, so I'm going to search for myself. So I enter my name up here at the top. I hit enter. It pulls up a couple different Joes. You can see this is my profile right here. And you can see that my role is both a provider, administrator, and a caregiver. And again, those three dots are here. If I click on those, I get some drop-down options. And this is how you can send a message to your caregiver. So you just click on this box, enter a message, and hit send, and I can send a message out to any of my caregivers that way. The next option is resetting the user's password. This is an important function because in the beginning, when this is new, a lot of caregivers are going to forget their password, and you're going to need to reset their password. Now, the caregiver also can reset their own password right from the mobile app. However, some of them are more comfortable calling the agency and asking you to reset their password for them. And you can see here, it's very quick to do it. You look them up, you click on the three dots, you hit reset user password, and it resets the password. So very easy to do. Now I'll click on the details link here, and then it will pull up all of my my profile. I can click on the little pencil icon here, and it will allow me to edit this profile. So you could say I haven't really filled in all my information like date of birth, last four, an employee ID that you may give your employees, a start date, an end date, address. All that information can be entered into all of their profiles. So you may ask, how do I get all my users' information into the system? Okay, there are two ways that you're going to load all of your users. One is you can load them all in bulk. We will provide you a template. It's basically like a spreadsheet that you will fill in all your users and all their information. You'll fill in all the columns. You'll save that onto your computer, and then you'll come over there to this little icon up here, this little cloud with an arrow in it, and it says import users from CSV file. You'll click on that, you'll find your file, you'll hit upload, and it will upload all of your users at once. If you are a smaller agency or you've uploaded all of your users, but now you have a new caregiver that joined your organization, and you want to just add one at a time, you're going to hit this little plus button up here in the right, upper right, and then you add one user at a time. Again, very easy, just like I showed you my profile. You'll fill in all that information and hit save, and now that user is created. All right, so that's recipients and users and how they all get loaded into your system. So setup is actually fairly easy. And then the next part is scheduling. So now your recipients are loaded, your users are loaded, and you want to start using the system. You're going to start scheduling visits. So we're going to go up here to the schedule tab. I'm going to click on that. It's going to take me to the schedule tab. Now, you can see my schedule is here with all my different caregivers. I can also search it by recipients as well. It converts it all to my recipients, so whatever view you want to look at. There's lots of different viewing options. Again, I won't go through all of those today, but there's many. You can look at it daily, weekly, monthly. There's lots of different ways that you can look at it. I can also search specific users. So if I want to look at myself, maybe I want to look at me compared to Joe Marty, I can look at multiple different calendars at once. Okay, so here's my schedule. By the way, Joe Marty didn't have anything scheduled. That's why he didn't come up. So I only have one visit scheduled today. It was scheduled this morning with Mr. Ryan from 10 to 11. And if I click on that, it will expand that visit open. It will tell me all the details. So you could see I completed the visit. That's the status. There was an error converting this visit over into claims. And really there's an error because this is a demo system and the claims isn't set up. But if there was an error, it's good to know what that error is so you can fix it in order for it to flow over into claims. So again, we'll go through all that in training. I was the caregiver. The recipient was Mr. Ryan. You can see I was scheduled for service code S9122, which is a home health aid visit. And these are all the tasks that I completed in the visit. And all those tasks can be set up in the system as well. The scheduled time was 10 to 11. The actual time, I logged in about 2 minutes early, which is fine. And I logged out about 2 minutes late, which is also fine. You can see my verification type was GPS. I used my mobile app to complete the visit. Now, you'll see start and end location variance, and it shows it on a map. So the visit was scheduled in Atlanta, Georgia. However, I'm physically in South Florida. So it captured my GPS when I logged in and when I logged out, or when I started or ended the visit. And you can see it showed on the map, I was 583 miles away from that location. All right, so then I also captured signatures via the mobile app for the caregiver, myself, and the recipient as well. So it shows those signatures on the screen. So it gives you a really nice overview of that visit in a quick summary format. And again, any visit that is on my schedule, I can go ahead and look at those. All right, so let's schedule a new visit. So in the upper right, you can see there's a little plus sign. When I hover my mouse, it says add new visit. I'm going to go ahead and click that. And then it's going to walk me through a scheduling workflow. So I'm going to click in the first box. I'm going to type in Ryan. And it brings up, again, my 3 Ryan options. We do list the Medicaid ID and the date of birth, just in case there are actually 3 Bruce Ryans, and I don't know which, how do I differentiate between the 3? I would differentiate by Medicaid ID and date of birth. So I'm going to go ahead and click on Mr. Ryan, and then the system automatically pulls information from Mr. Ryan's profile, such as who the payer is, the diagnosis code, the referring physician, and the Medicaid ID. Now, if any of this information is required by the Georgia requirements, and that information is not in the profile, then we will flag that for you and let you know. Okay, so under next step 2 is to select my caregiver. So I'm going to click in the box. I'm going to type in myself, Joe. You can see the Joes, and I click myself. Now all the services are listed. These are all the services that are available for this specific payer. So at some point, you may be using this system for multiple different payers. In the beginning, you're just going to be using this for Georgia Medicaid. So it will show you all the Georgia Medicaid services. Now, again, this is a demo, so these may not reflect all the Georgia specific services, but it will when you get your system. So let's get out and select Home Health Aid. I'm going to click in this box, and you can see these are all the tasks that my agency has set up for this specific service code. And it automatically defaults to checking all of them. If in this visit, I do not expect some of these tasks to be completed. So let's say we're not doing the laundry and there's no transport, and maybe not AM medication reminder. I just quickly uncheck those, and then those will not show up on the mobile app for that caregiver for this visit. All right, now step 4 is selecting the start and the end address. So remember, we set the Georgia address as the primary, so it defaults to that. However, if I want to select one of the other addresses, I just click the down arrow and I can easily select one of the other addresses. And then the map will resolve on that address. And obviously the start and the end address could be different addresses. You may start a visit in one location and end it in another. Next, step 5 is the date and the time. So I'm going to set the visit for today, January 8th. I'm going to start the visit at 1:30, and the visit is going to be for 1 hour, and let's say 30 minutes. Now, if I wanted to repeat this visit, I would hit, I can use step 6 to do that. I can hit open up this bar to repeat, and then it's going to give me a whole bunch of options to be able to repeat this. So let's say I wanted to do this visit every Monday, Wednesday, and Friday. And let's say I have an authorization until the end of February. So I select the date, I click over to February, and I click the last Friday in February. And now this visit is set to repeat every Monday, Wednesday, and Friday until the end of February. Very easy to set up reoccurring visits. Okay, I'm going to turn this off for now. I'm not going to repeat this visit. I'm going to hit save. Now, what it did is that visit ran through the business rules. So these are all the rules that we're setting up with Georgia. And these rules are here to help you so that you don't make mistakes, because mistakes just need to get fixed before you can submit a claim. So we try to flag any mistakes up front so that, again, you can be aware. And number 2, you can fix these proactively. So I won't go through all of these, but just one example, that the start date of this visit is outside of this member's eligibility range. So that might be a flag I might have concerns around, and I might want to look into that before I complete it or set up this visit. Again, these are just here for demonstration purposes. But I'm going to go ahead and save the visit without corrections, which the system will allow you to do. And then it saved the visit. It flipped me over to my visit screen. If I want to go back and look at my schedule, I can hit the schedule. And now I can see that here is my visit. So let me just put my name in again. And now you can see here's my visit for Mr. Ryan. I can click on that visit, and here are all the details that we set up. I haven't started the visit yet. These are the tasks that we set up. And here are the addresses that we set up. And we set up the start address different than the end address. Now, I'm going to show you how to manually complete this visit on the administrative portal. Now, again, the objective is that the caregivers are using the mobile application to complete the visits. However, there's going to be times when maybe they forget their phone, the battery dies, something goes wrong with the phone. They're going to call into the agency and said, oh, I really did complete the visit, but my phone died. So then the administrator has the ability to come in, open up the visit, and you can see down the bottom here, edit the visit, meaning I need to make some changes. Maybe my caregiver is sick today and I need to change the caregiver. I can cancel the visit altogether, or I can complete the visit. I can also print it out. So I'm going to hit complete visit. It's going to bring me to this screen. It's going to allow me to complete this visit, what we call manually. Now, this will get flagged during your claims process as a manually completed visit. And of course, we will not have the GPS of the location where the visit was completed because you're manually completing it. We can only get the GPS from the mobile device. So first I have to enter a note. Caregiver forgot phone, called to confirm visit was complete. So you're going to want to make a note, because if you ever have to go back for an audit, you're going to want to understand why is it that you manually completed this visit. Then I put in the times of when that visit was actually completed. I'm going to have to validate these times, obviously, with the caregiver. I'm also going to have to understand which tasks were completed and then check those tasks off in the system. And that's pretty much as easy as it is to complete a manual visit on the system. Now I'm going to go ahead and cancel this because I can't complete a visit that's in the future. Meaning it started at 1:30, it's supposed to be done at, I think, 3, and it's not 3 o'clock yet. So I'm going to just go ahead and cancel this. So I think this is bringing us to our end today, because we do want to get to the Q&A. So just as a quick review, we went through the dashboard, we went through the schedule. You can search all your visits on the visit screen. We're going to cover claims and reports in future sessions, and we went through and showed you how to load your users and how to change profiles where applicable for your recipients. So hopefully that gave you a good sneak peek and an overview of the administrative portal. So I'm going to bring the PowerPoint back up, and Brian, I'll turn things back over to you.
Great. Thank you for that overview, Joe. That was very helpful. So the next thing I want to go over is just upcoming town hall meetings. So we have done both of these town hall meetings today in February, today and yesterday. In February, we'll be diving a little more into claims. In March, we're going to be looking at a training preparation, because that's right before we get ready to go to pilot. So we want to really start ramping up the training at that time. Then we're opening up, we're going to have April, June, July, and August. We're going to have those dates open for topics based on your feedback and open Q&A. In May, we are going to do a specific training just on registration, because that's when the system will be in soft launch, and we recognize that a lot of people will need to get registered and do their registration functions. So I think the next part is our Q&A on the next slide. I do want to take time again to highlight this EVV mailbox. If you have questions outside of the administrative portal, or you just remember something later, please utilize that mailbox. I monitor the mailbox every day, and others monitor it as well, but we will respond to every single question in writing. No question has been sent to that mailbox over the last 2 years that hasn't gotten a response. If you need to talk one-on-one, and I got 2 of these yesterday, asking just to have a one-on-one quick conversation about EVV to level set, we can certainly do that as well. All you got to do is write the email box, ask me, and I'll do what I did to the two folks who wrote yesterday this morning when I said, what are some dates and times you got available over the next couple of weeks so we can work out that conversation. Okay, let's go through the questions, the ones that are related to the administrative portal. So we have some duplicate questions. The first one, and it's 3 or 4 times in here, is will we can have access to the video? Is the video online or the slides online? Yes. Every single presentation we have done, the slide decks are on our EVV website that we had at the beginning of the presentation. All audio recordings from every single presentation are available at the beginning of the presentation, on the EVV website. So you can go to the EVV website and re-listen to every single presentation on every single day we've done. And we put the EVV website on there, but the easiest, you can really just do GA, DCH, EVV, and as is going right now in Google, and look right there. It's the first thing that comes up. So you don't even have to remember the website. If you just go to Google and put in GA, DCH, EVV, I think you can even put in different combinations for that, and you will still get the EVV website. I've put in all kinds of different combinations. And I know I should bookmark the website, but honestly, y'all, that's how I get to the website all the time. Okay, so there were also several duplicate questions about participant direction. So let me just address participant direction. There will be specific trainings and breakouts for folks who are participant directed or consumer directed. Later this month, we will be meeting with all the fiscal intermediaries. Our plan is to treat the fiscal intermediaries like a provider who already has their own EVV system. That will cause the least amount of interruption to the members. You won't have to sign on to 2 systems, and hopefully their system, which we are pretty positive we can do this, will communicate to the TELUS system. So those of you who ask questions about, well, what about administrative portal and all of that? Will I continue to still use my fiscal intermediary system? Yes, the plan is for you to continue to use the fiscal intermediary system. Okay, let's see what else we got. Let's see, I don't want to miss anybody's thing. And if I do miss, please respond, please send it to the EVV mailbox. So I have a question that says, can TELUS be used without the internet? So the administrative portal, you would need the internet to sign in and get onto. We do use the mobile app in most of the instances, unless you have special permission to use the fixed devices, and we'll be looking at those on an individual basis. You would use an app on the worker's phone in order to access the TELUS system.
And Brian, just to add to that, the mobile app does work in offline mode, so it will allow you to complete a visit without internet connection.
That's a very good point. And people ask that a lot, like if I'm in a remote area or somewhere where there isn't internet. So thank you for saying that, Joe. Then the next question is, when you schedule and you modify the services to show what is anticipated, what happens when other services were actually provided than anticipated? So if you're talking about individual tasks, that's not a problem. You can mark what the individual tasks were that you did there. If you're talking about a service, remember that EVV is only for community living services, CLS, and personal support services. So other tasks such as community access individual or adult day health, those do not apply to EVV. The next question is, will providers, caregivers utilize e-signatures in the future? Yes. Our plan is to move as much as possible in the documentation realm to the EVV app, and so you can remove that hand documentation stuff. What is the cost for TELUS? The TELUS system is free. It's not completely free because you've got your own administrative time you got to do. You got to do stuff with your staff for training, but there is no cost for utilization of the telesystem. The state of Georgia is picking up the cost for utilization of the EVV system. Can you upload documents for provider caregivers in the portal? Joe, do you mind helping me out with that one?
Yes, so you can upload documents in via the portal, and those will be reflected on the phone. There is a limitation, I believe, to the size of the documents. I don't remember exactly what it is, but we'll go over that in training. And then you do have to be careful. The main reason we put a limitation is because if caregivers start downloading documents on their mobile phone and they're using their own phone, that will cause them to use more of their data on their phone, and we just want to be careful of that. So hopefully that answers the question.
Thank you. Very helpful. On manually completed visits, how do you account for caregiver and client signatures? There are other options than caregiver and client signatures. You can do not signed with a reason why the caregiver isn't signed. As far as the nurse sign-off visits, we're looking at how we can modify policy right now around that, and we should have more information when it gets time for training. There's a question about participant-directed members. Will we still be able to see the claims in GAMIS? Absolutely, you will. So this will not change what is available in GAMIS for claims. This will just move the information over into GAMIS where the claims are adjudicated. So yes, that information will still live in the Georgia Medicaid Management Information System. I think I answered the next one. Our hope is to, thank you for the question about, do we know if EVV and telesystems will take over for paper timesheets? Let me say this, and anywhere we can, we are going to try and remove paper documentation for the services that are covered by EVV. That is one of the benefits in this. We don't see any value in folks double documenting or doing something on paper when it's available online. There's a question about what if you want to, expand your TELUS use to other services other than just CLS. I would advise you to send that question to our mailbox, and we can forward it on to the appropriate parties. The frequently asked questions, I believe those are in the provider tab. So over here on the left where you see where Joe's got us, there should be a frequently asked question on here. There's so much stuff on here now, y'all. Yep, provider frequently asked question. There it is right there at the end. So you can see the provider one is right there, and we should have a member one that is up shortly. How will this system work with payroll systems? Well, this system is going to automatically send the information over to the claim system. You may want to write that question to the mailbox, and I can follow up with you on some more information. No, DCH is not going to be looking at all of your email messages and communications back and forth. Guys, we don't, that's not something that we're interested in doing. There's not that level of us that go in and look daily at what's going on, other than major reports or when you guys call with issues and concerns that you want us to look at. So again, if you'll send payroll questions to me, I would really appreciate that in the email box. Before EVV begins, as a participant-directed family, who would we confirm the primary phone number, address are correct on file? That would be if you are a recipient of Medicaid through the Division of Family and Children Services, just make sure your address is updated there correctly. If you are a supplemental security income recipient, and that is how you obtain your Medicaid, you're going to want to make sure that your address is correct with the Social Security Administration. And those are both good things for you to do as a member. So I'm just going to encourage you to make sure your address and phone number is correct with the Division of Family and Children's Services and with the Social Security Administration, because that's where we get your primary address and phone number for. There is right now, the state of Georgia does not have the functionality to also add private pay clients to this system. So that's not something that we can do out of the Medicaid dollar with taxpayer dollars, because obviously private pay clients aren't, we wouldn't use taxpayer funding to fund for private pay clients. So that's not something we do now. How do we prevent fraud with signature verifications? Well, the good thing about EVV is, I think you guys have probably heard me say more than once that I'm very interested in what EVV can do to increase the quality of services our members get by knowing when our caregivers are late or constantly missing, or when somebody is in the hospital and completing communication loops. But there is a lot of fraud, waste, and abuse things that can be captured from this system. So we would be looking at all kinds of, on a kind of global scale, all kinds of variances from the norm. Like Joe was just talking about earlier today, if somebody's home address is in Atlanta and they're clocking in Miami, that's something we're going to be interested in. We're going to want to know, I mean, maybe it's a valid reason. Maybe the caregiver has gone down there for some sort of, approved, authorized reason. But that would be unusual, and that is something we will want to look at. We're also going to be looking at how often signatures are actually done versus whether or not signatures are waived or another reason is put in. And is it normal for the member, or is it something we should be concerned about? So all those things will be things that we'll be able to look at from the department. The TELUS app can be downloaded on clients' phones. That is correct. Some clients do not have smartphones or cell phones at all. Then we would use a fixed device, but we're going to look at those individually, and we're going to need verification of the fact that they don't have a phone that is compatible. You lose a ton of functionality by not using the mobile app as a provider. Members use a ton of functionality as not using the mobile apps. So we're really going to encourage the mobile apps as much as possible. You need to clock in. The next question is about rounding to the nearest 15 minutes. You will clock in when the service begins, and you will clock out when the service ends. And we will use our standard billing rules that are included in the Part 1 Policy and Procedures Manual to verify and adjudicate claims associated with that. No, and the last, oh wait, there's more. There's more questions. We're getting a lot of kind of a flurry of questions here at the end. So how much will TELUS charge? I don't know. That question you're going to have to direct directly to TELUS. I don't know about TELUS's work. We're the state of Georgia, so we're doing the Medicaid and what's federally required for the Medicaid system. If any of you guys have questions for TELUS outside of what we're going through here as far as other business lines, that's outside of our purview here with Medicaid. The last question we have here on this side, and then I'll go back and check chat, is does the caregiver not have to clock in from the member's house? No, they don't. We recognize that not every member's service starts at their house and ends at their house. We recognize that sometimes services may start at an adult day health center, or at somebody's grandmother's house, or at somebody's cousin's house. So it doesn't have to always be at the home, but we will look, as with anything, with normal patterns of behavior to look and see what is happening and what's not happening. And in the instance Joe gave, that would certainly be a concern if the home place was in Atlanta and you're clocking in Miami, or you're clocking in on 285. Let's say I live in Decatur and you're clocking in, and we can see that your clock in point is 285 in the middle of the highway. We might question whether or not you were actually at the house at that point delivering service. Maybe you clocked in late and you picked the member up somewhere else and you were taking them home. But those are the type of things that we'll be able to see now that we really weren't able to see before. Let me see if there's anything else in chat real quick. The tasks are set up as part of the plan of care. So the plan of care and all the tasks will be available for you to sign off on. So even if it's not in your plan of care and do it, you'll be able to respond to that. The system, again, is only for community living services and personal support services. Any other services, whether self-directed or not, are not part of the TELUS system. There will be training on who to contact if there are billing issues or any kind of issues with, there's a whole module that's on resolving claims issues. So that's some training that we're going to get in the future. Please just continue to do what you've done today, which is attend meetings and keep track of the EVV mailbox. I can't tell you how much I appreciate you all's participation in these meetings. And I can't tell you how much I appreciate the questions you send to the EVV mailbox, because those help inform and refine the system. What I said in the previous meeting was, we're out of questions now. So what I said in the previous meeting was that we really do want to make this system a benefit to our members, first and foremost, and to our providers. So again, thank you for joining us today. Thank you for listening and taking part, and utilize that mailbox if you have future questions. Thank you, everybody. Have a good day.